Good evening, viewers. I'm Sumaya Mustafa, oral hygienist from Aquadent Dental Clinic.
And good evening, viewers. I am Sharon Aworo-Duong. I am Sharon Aworo-Duong, the dental laboratorist from the Aquadent Dental Clinic.
So today I'll be taking you through bad breath.
And I will be taking you through teeth replacement.
So the definition of bad breath, as we all know, is an unpleasant smell coming from the mouth, or in other terms, we call it halitosis. So for bad breath, what we are majorly going to talk about is the causes of bad breath. So for the causes, we have food, the food that we eat, and that is things like garlic, onions, spicy food. They bring out the odor, the bad smell at the end of it all. Then we have things like tobacco products, and that is smoking and also chewing tobacco. At the end result, it will be the smell will come out from the mouth. There is also poor oral health, and that deals with brushing, our form of brushing. How many times do you brush your teeth? Is it twice a day, or you don't brush at all? That brings about bad breath. We also have health problems. Those are the health conditions. There are certain health conditions such as sinus infections. These are infections like pneumonia, sore throat, and other throat infections can bring about bad breath. We also have dry mouth. There are so many people who suffer the thing of drying mouth, which brings about bad breath. We also have allergies, we have mouth infections, we have dentures or braces. If you don't take good care of your dentures and braces, it brings about the smell. Then we have the certain medications, the antihistamines majorly. The end result of taking such medications brings about bad mouth. We also have another cause, that is morning breath. When you wake up in the morning and your mouth is just smelling. And for this morning breath, it's because what it happens actually, when you sleep, there is no saliva flow in your mouth. Saliva inasimama, mate haitoki tena kwa mdomo, umelala. So ukilala, ukiamka, mdomo imekuwa haina mate, there's no any function taking place in your mouth. So at the end of it all, mdomo inanuka. Then we have pregnancy. Pregnancy also, during pregnancy we all know, mama mimba anatapika, akona nausea. So when they have all that, umetoa vitu za tumbo zote ndani, unazitoa. Ukizitoa inaleta ile harufu mbaya. Other causes of bad breath, others can be alcoholism, kukunywa pombe, taking vitamin supplements. Kuna supplements kama za samaki, zinaleta hiyo harufu kwa mdomo. So what are the signs and symptoms that can be once you go to a health facility, alafu useme niko na shida ya harufu ya mdomo, the first stop when you have halitosis is usually your dentist. Yeah, you'll think of the dentist first when you have a smell in the mouth. So once you visit the dentist, what they will do, they will check and see what brings about the halitosis. They'll check the cause. And if it's for the periodontal disease, meaning diseases of the gum, if it's disease of the gum, they'll treat it. If the cause is due to braces, then they will deal with the braces. They'll teach you how to brush your teeth, because for a person who puts on braces, they have a form of brushing technique. You don't brush like just any other person. And then food usually sticks on the wires, so you have to know how to brush, and maybe that could be the reason as to why uko na harufu kwa mdomo. Bad breath in babies or young children may be a sign of infection. You never know. So you take the baby to the dentist and they'll find the means as to why. Then when should someone see a healthcare profession about bad breath? So these are the things that ukishajiona niko na bad breath, so when inatakikana uende hospitali. Here, if proper oral hygiene does not get rid, you try to brush, you brush twice a day and the smell is still there, you really need to see a dentist. And 2, if there is persistent dry mouth, it's there, haipotei, mdomo imekauka, see a dentist. If there are sores in the mouth, hizi ni vidonda kwa mdomo, ukiona kuna vidonda, see a dentist. If you feel or you experience pain or difficulty while chewing or swallowing, visit a dentist. When there's a broken tooth or you're feeling dental pain, make sure you do visit a dentist. Then once you notice that you have white spots or tonsils huku kwa throat, ukiona vitu za white, visit a dentist. It could be a reason as to why uko na bad breath. Then if it goes on to fever, you feel fatigue, unachoka kila saa, make sure you do visit a dentist. Also, see a doctor or a dentist if bad breath develops after taking new medications. Umeprescribiwa a drug and you notice after taking that drug, unaanza kutoa harufu kwa mdomo. Usiketi, unyamaze, visit a dentist. Then we have different treatment options or home remedies for bad breath, which can be done to prevent bad breath itself. So what you're supposed to do, you're supposed to brush twice a day and you floss your teeth regularly. At least make sure before umelala, brush your teeth, floss, and make sure unatumia mouthwash. Then see a dentist regularly. Make sure on your to-do list at least once a year, do a checkup kwa dentist, akuangalie if you're using dentures or braces, if they are fitting well, they are not fitting well, talk to your dentist, make your dentist your partner. And then another one, if you're smoking, you better quit smoking or chewing tobacco. I know you cannot stop immediately, but at least try, upunguze. At the end of it all utaacha. And then use sugarless gum or sugar-free candy. Isikuwe na sukari. Make sure your mouth is ever active, unatafuna. And then keep the mouth moist by drinking plenty of water. It's recommended to drink at least 8 cups of water in a day. That's 1 liter in a day. Another thing, over-the-counter mouthwash. These are mouthwash that are usually, ukienda chemist, unamwambia, I want mouthwash, anakupatia, or you can also get them at the supermarkets. They are there. Make sure you own one. Every evening before you go to bed, use a mouthwash. Also, you should keep your mouth moist by using certain remedies, such as chewing mint. We have mint sokoni, you can get it and you chew it, or parsley. These are herbs which are good for you. And then if bad breath is due to health problems such as sinus infection, we have diabetes, we have acid reflux, then make sure such conditions are treated mapema isikusumbue. Then if bad breath is a side effect of taking medication, talk to your physician. They can change for you the drug. You use another drug if really bad breath is an issue for you. Then for patients who suffer from dry mouth, there are people who do suffer from dry mouth, like it's a disease. So what they do, you tell your dentist and they prescribe for you artificial saliva. Inauzwa pia. Yeah, that's all. I hope tumeelewana, my viewers. I hope mumenielewa. Yeah, in case of anything, you can just drop down your questions and we'll be glad to reply them back. Asanteni. Oh, umekata. Okay. Sasa unasonga na hii.
Nafanya vizuri sana. Nianze. Okay, good evening. As I had earlier introduced myself, I am Sharon Awuruduang again, the dental laboratories or the dental technologist at the Aquadent Dental Clinic. And today, as I said earlier, I'm going to take you through teeth replacement. So we are going to begin by defining teeth replacement. So teeth replacement is an art of restoring missing teeth in the mouth. Kwa Kiswahili tutasema ni mfumo ama ni tabia ya kuekeza meno for those people who miss teeth, kwa wale wenye hawana meno ama kwa wale wenye wanakosa maybe either meno moja ama mbili kwa mdomo. So we are going to focus on the several examples that we have in teeth replacement, which are we have the fixed dentures, which in other terms they are known as crown and bridge. We have the removable acrylic and flexible dentures, and we have the implants. So I'm going to take you through the above, and we're going to begin by defining the term fixed dentures, which in other words or in other term, they're known as crown and bridge. Normally, a crown is a cap that fits over an existing tooth. Kwa Kiswahili nitasema to make it to make it easy for you guys to understand, a crown is a cap, ni kama kofia inaekwa juu ya meno. Why do you need to get a crown? We have various reasons as to why the dentist will recommend to you that you need a crown. Definitely, one of them is a weakened tooth after severe decay or cavity. Once a teeth has been affected with carious diseases, it tends to be weak. And if left for a very long period of time, it might end up losing its function. So to protect it, the dentist will usually recommend for you to have a crown done so that you can preserve the tooth structure. Another thing, the reason as to why we can have a crown could be after treatment of root canal. Normally, after root canal treatment, the teeth is usually rendered as not alive, and it could be brittle at some point. So you usually are advised by your dentist to crown it so that you can preserve it for a very long time. Another thing, when a teeth is cracked or even damaged, you can put a crown on top of it so that you can protect it from maybe sensitivity or other dental diseases. Or to align your bite. Another reason could be to align your bite. Some people have not well arranged teeth. We call that malocclusion in English, in other words. So you can use a crown to correct that. Another reason to have a crown is when your teeth has suffered fluorosis or maybe has dental stains, and that the stains can make somebody to lose their self-esteem. So we can use a crown to improve the aesthetics of the teeth. This helps you to achieve a beautiful smile. Another thing, we can crown up for cases whereby we have a dental implant in the mouth. So we use a crown to fit it over the implant. The process may be different for each type of dental crown. In general, getting a crown involves stages whereby a dentist will maybe take an impression. Kwa Kiswahili, impression is kipimo cha mdomo, because I cannot work in the lab without I cannot work on you physically in the lab, so I'll have to take the measurements of your mouth so that I can fabricate the crown inside the laboratory. So after the impression is taken, there is a process we called tooth prep. That is a process whereby the dentist reduces the size of the teeth to fit the new crown that is going to be fabricated in the dental laboratory. Meanwhile, after the teeth is prepared, the teeth is usually sensitive. So we usually advise to fabricate the temporary restoration or a temporary tip to fit in that on the prepared teeth to avoid it from sensitivity and protect it generally. Okay, we have images that explain what happens there. There is an image of a crown fitted over a prepared tooth, as you can see in the slides, and the before and after image showing a mouth of a client with a teeth prepared to fit on a bridge. The main types of crowns used in dentistry include the gold crowns. We have the all porcelain crowns, which are all ceramic crowns. Under the all ceramic category crowns, we have the zirconia and IMAX. We do IMAX in our dental laboratory. Then we have another type of crown that we do in our dental laboratory is the porcelain fused to metal crowns. The porcelain fused to metal have been in the industry for a very long time. They are not affordable too, but they have numerous advantages. We do that in our dental laboratory too. And we have the porcelain fused to metal crown have a metallic base that is going to be in contact with your prepared tooth and is covered with porcelain. Porcelain is an all ceramic material that has teeth-like properties. Mark you, when we do teeth replacement, we ensure that the teeth is resembling your initial teeth, the teeth that was prepared, the missing teeth in shade and the morphology. So aside from that, we have the zirconia crown, which I had explained earlier is under the all ceramic crowns. So next we have the Emax. I had said earlier it's an all ceramic. So that is our first type of teeth replacement that we've discussed under the crown and bridge. So on to the next, we will go to dentures. So in dentures, dentures are also known as false teeth. Kwa Kiswahili, you'll hear people saying they have meno ya kubandikwa. So dentures are known as meno ya kubandikwa because you can easily remove them and at the comfort of your home. So under the dentures, we have different types. We have the complete dentures and the partial dentures. The complete denture is for somebody who is missing all the set of teeth inside the mouth, either on the upper or the lower jaw. So for that person, you will need to replace a complete set of teeth inside the mouth. We have the partial denture. The partial denture is removable replacement for just one or few teeth. These are for people who miss a few set of teeth inside the mouth. We have images there that show you how crowns with porcelain fused to metal crowns look like. Then we have an image of a patient fitted with gold crown. Then down there we have an image of patient fitted with Emax crowns to improve the aesthetics of the anterior teeth. As you can see, the anterior teeth were a bit malaligned. They are not in the correct shape and posture. So this client came for the replacement of that. Okay, another thing, the reason as to why you will need to get dentures, if you have problems with eating, maybe normally when you have no teeth, it means you cannot chew. It is so difficult for you to chew. And when you have no teeth inside the mouth, you cannot speak well. So the dentures will definitely help you, help your problems with speaking and feeding problems. And normally when you have teeth inside the mouth, they improve the aesthetic appearance of the smile. Like it improves the facial aesthetics. So when you have no teeth, it means your face will definitely collapse and you will look funny. So the dentures will help with that. Alafu, definitely when you have an awesome smile and when you have teeth in the mouth, it boosts your confidence. So we have, as you can see in the slides below, we have images. We have up there an image of the complete denture. Then we have an image of a removable partial flexible denture. A partial denture is just like an acrylic denture, only that it's different in design. And as you can see, it's partial since it replaces just few of the teeth inside the mouth. Then we have an image of a removable partial denture in metallic. The one in metallic, that's another term, we call it a cobalt chrome. This cobalt chrome is a metallic partial denture that is used to replace missing teeth inside the mouth. It's still in the category of dentures, only that the base is fitted with a metallic support. And we have a removable acrylic partial denture, which has the support of clasps instead, or wire work that supports it inside the mouth. We have an image there showing how a patient will look before and after a complete denture. Then we are going to the next category, which is the dental implants. In layman's language, an implant is a metal post that replaces the root portion of a missing tooth. The dental implant is usually like a surgery procedure that replaces roots with metal and screw-like posts and replaces damaged or missing artificial teeth that look and function like the real one. You can see on the image shown there, we have the dental implants. We have the metallic part that is fitted on the jaw. That is to give support. That acts as the root of the teeth where the crown will be fitted onto, or the denture. You can see on the other image, I've explained well, whereby the implant acts as an anchor for the crown. Alafu, we have the abutments that connects to the crown, that connects to the crown, to the dental implant. Then we have the custom-made crown, the crown that we fabricate in the lab. We do that too, that will be fixed onto the jaw. Alafu, the reasons as to why you will need, or why and when are dental implants used. Dental implants are necessary when you have missing teeth, but you don't want to do the other type of teeth replacement. Maybe you don't want to get the normal dentures or the crown and bridges. So that's where a dental implant is required. It's actually the best way, the best form of teeth replacement, since we seek support from the jaw itself. As you can see on the next slide, that's an image of a patient who was missing the anterior teeth and came for replacements of the implants. So we fitted the implants with the normal crown and bridge fabricated in the lab. Yeah, so that's the end result. I'm so grateful for this session. Thank you for listening. Asanteni sana.